Hey, it's Dr. Brandt Green with Annapolis Pain Management, and one of the things that sets us apart and makes us a little bit unique compared to traditional pain management is our chiropractic services. Now, what I find a lot of times when people come into the practice is that they don't really understand what chiropractic is, and so they're either afraid of it or they've heard bad things about it, or maybe they've heard good things about it. But for many of the people that come in and don't really understand what chiropractic is and what makes it different or what sets it apart from physical therapy or massage, we try to simplify the message very simple. And so that's what I'm going to do right now is I'm going to simplify our version of chiropractic and how we explain it to patients and then why it's beneficial. So the simplest explanation for chiropractic is a chiropractor is very highly trained and specialized type of healthcare provider that spends the majority of their time in school studying the spine, muscles, joints, and tissues, right? And so we're really focused on the spine and the nervous system, joints and tissues, so musculoskeletal experts and nervous system experts. So when it comes to treating people with chiropractic treatment or treating them with manipulation type treatments, the goal basically in a very simple manner is to assess the spine, assess someone's posture, assess their mechanics, and we look at their joints and their tissues and say, all right, is it moving the way that it should? And if it is, that's great. That means it's performing the way it's supposed to, it's moving the way it's supposed to, and those tissues and joints are healthy, and as a result, you're going to be healthy. If we check and assess you and we see that you've got tissues or joints that are stiff or stuck or fixated or tight or restricted, what that does is it causes the body to respond with inflammation, irritation, pain, adaptation. It causes the body to move in a way that it's not supposed to, and then it kind of cascades into these other issues. And so the whole point of an adjustment is to take things that are stiff, stuck, tight, fixated, and to restore movement. So the point of the adjustment, when the chiropractor uses their hands or they use instruments like these right here, is just to take things that aren't moving and get them moving again. That's it. To take things that are stuck in the spine or in the joints and to restore movement. Now, the skill set that chiropractors have that other providers don't typically is our ability to adjust or manipulate the spine and or extremities and other joints. We're really good at mobilizing joints. Many of us take extra training and specialize in soft tissue, much like myself and the other providers here at Annapolis Pain Management. We really take that extra effort to put in the time to understand the soft tissue and the hard tissue side of things. So we come at it from a complete approach, and then we follow that up with keeping you from getting stuck again. So the adjustment on the table takes things that are stuck in your spine or in your joints that are fixated and stiff, and we're restoring movement. We're getting that movement in there, and you hear those little clicks and pops. Those are little cavitations. Those are just basically little pressurized air pockets in your joints that are, when we put movement in there, we get a quick decrease in pressure. And when you take a pressurized area and you quickly decrease pressure, you get a cavitation or a pop. So that sound that you hear is just air. So nothing to worry about when you're getting an adjustment, nothing, those cracks and pops and clicks and all those things. It's just air. It's not actually popping or cracking anything. But it is a signal that we are getting movement into a joint, and that's a good thing. So following up the adjustment is just as important as getting it moving. So traditional chiropractors sometimes stop at the adjustment, and you become kind of reliant on getting an adjustment to get things moving again, which is okay. But what we try to do here is we try to fix the reason why you got stuck in the first place. Now, the reason why you get stuck or fixated is because adaptation, postural changes, deformities, movement deficiencies. So basically, your body's chronically adapting to these really bad environments, like sitting at a computer desk or looking at your phone all the time. And so things get stuck and stiff and tight to just try to compensate. So instead of just adjusting you constantly and try to get that moving again, and that's going to help, what we try to do long term is to fix the postural deformity or the movement deficiency. So we work on correcting your posture through muscle memory, strengthening. We look at your mechanics and ergonomics when you're sitting at a desk to make sure that you're sitting in an ideal position. And we do this through a lot of different ways, through exercises and stretches, through tractioning your spine to try to actually kind of move it back into position, very similar to the way a dentist would move your teeth with braces. And so that tends to give you a better long-term solution versus just that relief from the adjustment. So when we treat you at Annapolis Pain Management with an adjustment, we want to get things moving, get the inflammation down, get the pain down, get you feeling better, and then get you moving better, and then work on strength, stability, long-term, posture. So then you stay feeling better. We don't want you having to come back in all the time for the same thing over and over and over. We actually want to give you a long-term solution. And ultimately, prevent breakdown, prevent arthritis, prevent degeneration, and then prevent you from having to get surgery or repair later on in life. So that's the breakdown. Basic component of a chiropractic adjustment, just to recap, is to take things that are stiff, stuck, and tight, not moving well, and just to get them moving again through adjustments, manipulation, using tools like this, specialized tables like this, even where we have little drops and breaks in here that allow us to get an adjustment without a lot of effort or a lot of force. So, depending on your tolerance for pressure or pain, we can get relief, we can get movement in there. The key is movement. Movement's going to get things feeling better. It's also going to give good signals to your brain and help your brain process movement, and movement overrides pain. Same reason why when you smash your thumb, you shake your hand, feels better. Movement overrides pain. An adjustment is basically supplementing movement into your spine that you're probably not getting on your own. So that's the gist of it. If you have more questions, shoot us an email at info@annapolispain.com or drgreen@annapolispain.com. Check out our Facebook, Annapolis Pain Management, or even just check out us on online at annapolispain.com. Again, I'm Dr. Green, and that is the rundown on our version of chiropractic adjustment. Thanks, and have a great day.